to get a sandwich. Playing in every language. Yeah, we know a piano in every language. Spanish and Portuguese. Fight the fight like Chinese and Japanese. Try stop the thing, the Celtic and they can never breathe. Tap farm, Javan, Ferran. Pull up and gyal run the like Heron. Grew up coarse and wild and dark. Full of venom, Fendi dep on the boss and all the man. Struggles and pain what we been through. Me no like informer, me no bring news. Buy a house on the beach with a hill view. Oh, you feel no pain like the youth, them a see you. Yeah, come me little bit me have the show.
WEFM is SVG.
Activated Mornings on WEFM 99.9 is on now.
Good morning once more to our wonderful listeners. As usual, when it's after 9, Monday to Friday, we've come to the final talk segment of the morning. And this morning, we have a special guest in studio. But before I get to our guest, let me say good morning to Nicole, who is joining us for the first time this morning. Lovely to have
Good morning. It is good to be here.
All
Good
right.
morning, everyone, everywhere.
All right. And in studio, we have with us this morning Dr. Tami Williams, who's going to do a presentation on cervical cancer. And of course, you are going to have an opportunity to interact with her. So you can call us after she has given her presentation. You can call with your questions and with your comments as well. And good morning to you, Doc. Over to you.
Hi, good morning, Dianna. How are you?
I'm good. What about you?
I'm okay. I'm good. Let's say I'm good. I'm good.
You look good in that chair, you know. Rajiv, Roleza, Nicole, she's looking co-hosty in that chair there, you know. So
you look good as well. In the blue, green.
All right. So what are we going to discuss this morning as it relates to cervical cancer?
All right. So again, good morning to all the listeners in St. Vincent, regionally, internationally. So I'm just going to do a little touch on stuff like what is the cervix first. We have to start with that. Cervical cancer, give a little stats, diagnosis, treatment, just briefly, prognosis, those sort of stuff.
All right. So let's get right into the discussion. The first thing is, what is the cervix?
Yes. What is the cervix? So I'm not sure if, well, we should be familiar with the term womb. Right, Dianna, you know what is womb, right?
Definitely.
Right. So it is the lower portion of the womb, and it connects the uterus, which is the womb, to the vagina, right? And it have numerous functions. We don't have to go too in depth, but it's especially important in pregnancy. It will lengthen and get thinner closer to the time of delivery. So it have very essential roles, right, in the body. So just this question is for you, Dianna. You know anything at all? I'm sorry, I put you at this spot. Anything is anything at all is acceptable because you know
no wrong answer.
Pressure
here.
can be on me.
Okay,
right.
Let's go.
Anything you know about cervical cancer before we start?
To be honest, no. All I know is cancer of the cervix. Now that you've asked me that question, that's all I know about cervical cancer. What about Nicole? Maybe Nicole, what do you know? You know a little more than Dianna about cervical cancer.
Well, I have to welcome Dr. Williams, first of all. And secondly, I want to say I don't want to take away the spotlight from expert Dr. Williams. However, I would say that, you know, one of the things I am always I take a lot of care with is understanding my anatomy. So I do
Right.
think I know where the cervix is. And so, Dr. Williams, take it away, because I think I don't want
All right,
to
I'll go straight into
misinform
it.
the
Straight
world.
into it. Okay, so cervical cancer is the third most common cancer of the female genital tract. This is specific to data collected in the US, and it is very prevalent in women between the ages of 35 to 44 years, right? So in terms of the causes, so there are two main causes, right? So you could be infected with a virus called HPV virus. Specifically, there are a lot of different subtypes, but just to be technical, 16 and 18, right? Those two subtypes, especially. Also, persons who have a immune compromised state. So, in the sense that, okay, for example, HIV patients, diabetics, anybody with people who would have received a transplantation because they would have been on some medications that would make their immune system compromised, right? So just some risk factors for contracting the HPV infection: so multiple sexual partners, early onset of sexual activity, and numerous pregnancies. Also, history of a sexually transmitted infection, right? Also, there are environmental risk factors. So, cigarette smoking. So, it could be either primary or secondhand. So, secondhand exposure to other persons around you smoking. And something called DES. It was commonly used back then, not really used now. Diethyl stilbestrol. Nobody's going to remember that, but just know it's DES, right? And low socioeconomic status. So, I guess just to expand a little bit on that, so persons who have a poor, a lower income, they would have how to put it, because these days it's so technical because things are at a reduced price for persons, but still in terms of the healthcare, right, you still have to pay for most things, right?
Yeah.
Even if it's at a reduced cost. And if they can't afford this reduced cost, they are at risk, right? Also in terms of the treatment too, you would find in this sort of population, they would start and relapse, fall off due to financial difficulties, right? So let's talk about the epidemiology now. So epidemiology can be divided into mainly incidence and prevalences. So incidence are the number of new cases, right, of a disease, which will be the cervical cancer in this case. And prevalence would be the total amount of persons with the disease in a specific time or period. So, for example, this year there are 25 cases of cervical cancer, right? But however, so out of the 25, there might be 2 new cases from prior, right? So the 2 new cases would be the incidence, right? So the incidence has drastically declined over the past 40 years due to screening and HPV vaccination. I mean, I wasn't really going to touch on this, but I'll just touch on it very briefly. Dianna, putting you on the spot again.
Oh, Lord. That's okay. Go right ahead.
No shame. Do you know how often you would have a pap smear done? You've heard about pap smear?
Yes.
Okay.
I knew this information the other day, how often a woman should have a pap smear done, but I have completely forgotten. Let me make a guess. I'm going to make 2.
Make a guess.
First guess, every I wouldn't say every year. I will say every 2 years or every 5 years, randomly. Any of those correct?
I would say that. I would say
Yeah,
that.
me.
But
I get a little pass mark.
yes, yes. Ideally 3 years. It could
okay.
vary depending on the age. For example, persons above 30, they might allow a little bit leeway in terms of 5 years.
Okay.
Also, the HPV testing is recommended every 5 years.
Okay.
Right. So every
Is
3
there
years.
is there an age range for who should get tested?
So yes. From 21 years.
Okay.
They say up to 65 years.
Okay.
Right. Well, when I said that, I mean CDC. As per CDC.
Right.
Yeah.
Okay.
So, but it still depends on other. If the person have risk factors, high family rate of cervical cancer, those sort of stuff. Maybe exceptions would be given, right?
Okay.
So maybe it would be continued for a longer period, but up to 65 is normally the case.
All right.
Right?
Okay.
For the vaccine, around 11 years,
Okay.
you could be vaccinated, because the reason behind this is they're saying that's when individuals are more likely to be sexually active.
Okay.
Right?
Is it a one-time vaccine?
Different countries, they would vary.
Okay.
I know about two
Okay.
vaccines.
Okay.
But it would vary depending on where, right?
All right.
Okay, moving on. Symptoms. So generally, if it's early stage cervical cancer, you tend not to have any symptoms, which you could imagine is alarming, right?
Yeah.
Hence why screening is important, because it would help to detect it at an early stage where the necessary treatment will be effective,
Yeah.
right? So you could have abnormal bleeding, vaginal bleeding, let me specify. Vaginal bleeding, not anal bleeding. I mean, you see, medicine is so technical, right? If it has spread to the anus or rectum, then you could get manifestations of anal bleeding. You see where I'm coming from, right?
Okay.
Yeah. But the bleeding especially is after sexual intercourse. Not saying that every person, if you have bleeding after sexual intercourse, you have cervical cancer, right? Go and get yourself walked up by the relevant healthcare provider. Also, a vaginal discharge, especially a pungent odor, foul smelling odor.
Any specific color to look out for
the discharge?
Yeah.
Anything like green, gray, irregular.
Okay.
Because like a white discharge or it's a colorless, that is normal. Right. So
okay.
Right, but it could vary. So painful sex also, and pain in the pelvic region, and also like for if it has spread, right, you'll have other symptoms. So for example, if it spread to the bone, you might have bone pain. If it spread to the, so it varies.
Okay.
Right, but those are the main symptoms. So diagnosis. So you have the pap smear, right? You have, even the basics too, just a routine examination, right? A pelvic examine. Where you use a speculum or vaginal examination. You could feel irregular.
Don't know what a speculum is.
sorry. Speculum is how you get the pap smear sample. That's the metal thing that goes up in you.
Right. Okay.
The pregnant ladies don't know what I'm talking about. Right. So the gold standard is the colposcopy with a biopsy. Biopsy is just taking piece of tissue,
Right.
That would the biopsy would confirm the diagnosis, right?
Okay.
There are other imaging studies that you can do, which would help to classify the staging. We get to that just now, but staging would tell you how far along the cancer is, right? So, right, I was saying the biopsy
Yes.
and the imaging, right? So with the imaging can include stuff like CT scans. MRI is more detailed. It will give you a better idea of the depth of invasion, those sort of stuff. Right? Right. So let's move on. So in terms of the staging, there's something called FIGO. Not going into the abbreviation, but FIGO staging, right? And it's from stage 1 to 4.
Okay.
Right? And it will basically tell you the size of the tumor. Okay, so it's staged based on the size of the tumor. For example, if it's more than 5 millimeters, it's this stage, right? Also, if there are any extension of the tumor to the surrounding organs, so it could be nearby organs or organs further away. Also lymph nodes. Right? So in essence, the higher the staging, the worse the prognosis. Right? So stage 4 has a worse prognosis than stage 1. Right. So in terms of the treatment, how are we doing with time, Dianna? I just want to make sure.
Well, it's 9:49, so we could. I think Rajiv will give us a notification when the time is right.
Yeah, I should be finished soon. I mean,
Okay.
it's a big topic.
It is. Yeah, it is definitely.
Yeah. So I just at least want to highlight the important points.
Okay.
So for surgery, you have many different options. You could remove a small segment of the cervix. That's one option. You could take out the cervix and some of the vagina, and it's like a fusion between the uterus. So remember, the uterus is above and the vagina, right? After you already remove those.
Right.
That is one procedure, right? You notice I ain't going into the technicalities
Right.
of the procedure, right? Yes, you could do chemotherapy, radiation, and a combination of both, right? In terms of the staging, for the stage 4B, because it have 2 types, that last stage is palliative treatment. So there's no cure for it, right? So these stages above, you could do interventions, right? Even stage 4A, the prognosis is poor. I mean, you could do this. There's another procedure that you take out plenty things, right? The vagina, the uterus, the cervix, the lymph nodes, right? It's a very extensive procedure. But with that one, how do I put it? So yes, it is a curative option, but you at risk for morbidity. So as morbidity, right?
Yeah. Okay.
So a lot of complications after the procedure, right? So in terms of the follow-up, initially every 3 months for 3 years, and every 6 months for 5 years, then yearly afterwards. I mean, it varies from place to place, right?
Right.
This is just a general overlook. So persons who did fertility sparing surgery, the fertility sparing one would be the one that I spoke about in terms of removing a segment of it. And the one where I told you joining the stuff together, right? So those are the fertility sparing ones. Right. So if they're negative so those with the fertility sparing surgery who did it, right? If they're negative for cervical cancer for 5 consecutive years, they do not need follow-up testing and can continue doing their routine cervical cancer screening like the general population, right? But the requirement is the 5 years, right? No signs of cancer.
Okay.
So it's important to do the follow-ups, right?
We probably have like maybe a minute or so. Rajiv, is our grace period up?
I almost finished. So the treatment in pregnancy and specifically is especially important to involve the gynecological oncologist, and the treatment options would be the same for non-pregnant individuals. However, with pregnancy, radiation is one of the treatments. So you have to be mindful of this. It can cause spontaneous abortions, right? So there's the option of doing chemotherapy during pregnancy.
Okay.
So complications of the cancer. Soon finish. I tell you, soon finish. Metastasis. Well, we mentioned that, but to the liver, the bone, the lungs, the brain, common areas. Swelling to the legs, you could have a fistula formation, right? Between, for example, the vagina and the anus. So, which means that stool can come through the vagina, right?
Okay.
So, sorry for the visual imagery. The complications of the treatment include narrowing of the vagina, vaginal dryness, painful intercourse, inflammation of the bladder, and also the fistula formation. So the prognosis, I'm just going to touch on the prognosis, and then I think, just briefly on primary and secondary prevention, and then that will be it. All right. So patients who do not have spread to their lymph nodes have a very good prognosis, right? And cervical cancer has the best prognosis out of the 3 main gynecological cancer. Because remember, I said the third most prevalent, right? So the other 2 would have been ovarian and endometrial, right? And in terms of the prevention, lastly, Jeef. So you have primary prevention and secondary prevention. Primary prevention includes the immunization and counseling on safe sex practices. So the goal of the primary is to tackle it. So it's it's to prevent it on a whole, right? You're not getting it. Whether it's early stage cancer, you're not getting it, right? So the safe sex would prevent the HPV transmission, like I mentioned prior. And then the secondary prevention would be screening, right? Because one of the main goals of screening is to identify cancer on a whole, not just cervix, at an early stage, right? So it is to control it when it's been, it's already been diagnosed at that early stage, and it's to control it from getting it worse, right? Yes. So any questions?
Well, I was somebody here is asking, what can a man look for to help his woman with, he's talking about cancer of the breast, but I think he answered the question. He said we can feel for lumps.
Yes.
Okay, so that was definitely can. That one was to deal with breast cancer there. Right. That wasn't a question for cervical cancer.
Smiling.
Rajiv, you have any questions? All your questions were answered. That's wonderful.
Wow,
and I think that we can bring her back because it's a lot of information. I think we can bring her back to continue this session so we could have a longer session with a little more interaction.
Yeah, I think that's important.
So
many things to touch on.
No problem. Yeah, there's a lot of things that you can mention, and it's so important too because it's one of those cancers that you can screen for. Not all cancers you can screen for. So
Okay. Information there again.
Yes.
But I think with that, I think we're gonna have to head out now. It's 9:57, quickly approaching 9:58. So I don't know if Nicole had anything to say to you. If not, no.
Yeah, we need Dr. Tami. We need to have you back. I think there's a consensus here, and not only that, but really, this is not something we can run through. I always tell people when it comes to health, and especially women's health, we cannot
Right.
run through it. It has to be
Yes.
almost like a series or a systematic approach to conversations. So I look forward to hearing you again, and we look forward to welcoming you back soon.
Thank you very much. Anytime. My pleasure.
Yeah, that
Thank
anytime she said
you.
Rajiv, so we on. All right, so that was Dr. Tami Williams, and she was giving us, unfortunately, she couldn't give us anything in depth, but she was giving us a brief synopsis of cervical cancer. Some persons say cervical cancer. I'm going to ask about that, but another time. Right? So she gave us some information there on that particular illness. And it's now 9:58, so we are going to head out of here. If you have any questions for her, write them down. So when she comes back next time, we can ask all of those questions. For now, we are out. I think that I want to take this opportunity to sign off as well. Nicole, you and I can sign off here right now. This is Dianna, and I've been with you since 6 o'clock, keeping your company. I hope that you're going to enjoy the rest of your day and that you are going to be safe.
And this is Nicole signing out, wishing you a healthy and happy day wherever you are. Take care.
All right, Tami, you're signing out too.
And this is Dr. Tami Williams signing out. Wishing everyone a good day.
All right.